Well, welcome everybody to another episode of Your Spiritual Journey. This is Dr. Bob Dove, and today I'm with another doctor, a medical doctor. But before we get into that, I'd like to encourage you to subscribe. The more subscribers we have, the longer we'll be able to stay on the air. So that's helpful. Please like us, follow us. Feel free to leave comments. We enjoy your comments all the time. And if you would, consider subscribing to us on Patreon. Today's guest is Mary Chester Wasko. She's a recently retired rheumatologist, and her faith journey has been in fits and starts over many years. She is currently treasuring the time to reflect on that journey and working to discern God's plan for this next phase of her life. And that's really all she wanted me to say as an introduction. But I'm going to go a little further because Mary Chester is one of the most humble people I know, and humility is a wonderful trait, but it doesn't give you much information about her. So I'm going to let you know that she is a very renowned rheumatologist, and although she is now retired, I think you should know that she graduated with honors from the North Carolina Medical School in 1983. She's had 40 years of diverse experiences in that field. And I did a little research on her and found out that about 10 years ago, she actually testified on a committee at the state level. And I'm going to ask her some questions about that later. But she is pretty well known, and I know that she got some kind of recognition before she retired in terms of being one of the top physicians in Western Pennsylvania, or perhaps it was in all of Pennsylvania, one of the top 10. So we are honored to have her with us today, and I'm going to just turn the mic over to her to let her talk about her spiritual journey, and then I've got some questions. I've already got some questions before she even starts, but we've known each other for many years. She's a member of Waverly Presbyterian Church, which if you've listened to these podcasts, you know that that's the church that I attend. So without further ado, Mary Chester, it's all yours.
Thank you. And I appreciate the kind words, but don't overestimate my contributions, but thank you.
I just say don't underestimate your contributions.
I am a native of North Carolina. I've been in Pittsburgh since 1991, and my faith journey began in North Carolina in a small rural church, Methodist church, that was started by my ancestors in the 1800s before slavery came to an end. And it was a Methodist church. When I attended that church with my family in the 1960s, and to the present day, it remains segregated. The church was, I would say, a traditional Southern Methodist church in that I remember the message of God being one that was more punitive, and there was a lot of talk about sin and our wrongdoings and how unless we repented and had some kind of conversion experience, we weren't truly saved. And I remember attending revivals as a child, and anyway, it was an a message that was hard for me to move beyond as my faith journey has evolved. When I went to college, I attended a Presbyterian school and attended a Methodist church during college. It was a very welcoming, loving community, as was my childhood church, but the message sort of evolved a bit and was not as much of an Old Testament message, I should say. Medical school was a challenging time for me, not only because it was very demanding academically and physically just because of the hours that were kept, but from a faith standpoint, I remember it being sort of a desert.
Well, what was behind your decision to go into medicine to begin with? Because as a woman, that wasn't often a popular choice back then.
I had elderly women relatives who were physicians.
Okay.
I wasn't particularly close to them, but I certainly knew of them and interacted with them on occasion. But really, it was not a great altruistic decision. I had two younger brothers, and my younger brother was the one my mom had always designated as being the physician. He was slated to be pre-med, and it sort of got my goat that wasn't an option that I guess she had considered for me. She always encouraged me / pushed me academically, and always felt strongly that I should be able to support myself and be independent. But in terms of careers, medicine was not something that was on the radar for me. At Davidson, the school had just become co-ed 2 years prior.
So
it had been a boys' school.
Davidson was your undergraduate?
Undergrad, okay. Yes. And it had been all male for over 100 years until 2 years before I attended that school. And it was very strong in pre-med and pre-law, and I was exploring fine arts, liberal arts courses, and sort of defaulted into medicine after a summer experience with some pre-med students at Oxford in England. And I started doing some volunteer work, took some science classes, and it just evolved.
All right. So how'd you end up at Oxford?
Oh, I always loved Elizabethan history and literature, so the focus was Elizabethan, the Elizabethan time period. So
you didn't go to Davidson for the dating opportunities, since
no,
it was
I did
almost
not.
all male. Okay.
No, I did not. That is for sure. That was no.
Okay. All right. So getting back on track, I know that I took
That's
you
okay.
off track here.
That's okay.
So we were just about getting you into medical school now,
Right.
and what was happening there?
Medical school was really challenging. I had the good fortune of making some very close friends who remain friends to this day, and I visit and travel with them periodically. Certainly academically, I had my hands full, and I mentioned that the schedule was pretty demanding as well. I found, in terms of faith and discussions about religion and how that might influence wellness and approach to health care, the only talk that I recall even addressing spirituality was a gentleman who had pancreatic cancer, and his life expectancy was short because of that diagnosis. He spoke to our class about imaging that he did of warriors fighting his cancer. And for some reason, I also remember an image of light being a factor in his battle against his malignancy. And he didn't really address God or any other supreme being, but that, in terms of addressing spirituality, approach to health, wellness, and so on, that is the only talk in 4 years of medical school, or even only discussion that I recall that addressed anything remotely connected to the intangible dimension of wellness.
Yeah. Yeah, in fact, I recently had on this podcast someone who had pancreatic cancer, and he was given maximum 5 years to live from when he got that diagnosis. And this is over 10 years later. And he had journaled throughout that experience, and his wife had journaled from her aspect of the caregiver. And that was quite a faith journey to see how he got through that. Mm-hmm. And that book has been very helpful to other people with cancer. But I understand, because you responded to someone who another medical professional who I interviewed on this podcast, about the lack of connection between healthcare and the medical community and the role that spirituality can play in that. So would you elaborate some more on that? Because I think that's where you were going with your comment.
Yeah, I guess I am still trying to sort that out for myself and trying to figure out at this point in my life how I can better educate myself to integrate the two, not only for myself, but also for patients I may encounter and family and friends. During my years of practice, I never felt completely at ease bringing up my faith with patients, but when it would come up, I certainly never would shut them off, and I would tell them that when they would refer to some of their struggles and their faith or consideration of a supreme being might come up, I would just say that I would pray for them. And I'm not sure we do our patients a service when we don't really provide support and encouragement and dialogue with them about how their faith interfaces with their health struggles. I think some of my hesitation was not knowing how my superiors might respond to that tangent of healthcare, and I didn't feel equipped to develop it further myself and defend it when I was practicing. But I'm still chewing on it. Yeah. And I hope I have an opportunity to do it a little differently in the future when I return to work in a couple of months.
Yeah. Wait a minute. You're going to return to work in a couple of months?
Yep.
This is called retirement. Huh?
I know. Well, the community where I grew up is quite impoverished in many ways, and there are no healthcare providers in the county where we will be returning in North Carolina, where I grew up.
In the whole county?
There is a woman who comes to the county a couple of days a week, and she does some telemedicine, but there's no hospital, no physician. There is a pharmacy, which is like the beacon of light as far as I'm concerned, that provides vaccinations and prescriptions and other medical supplies, but that is it. And I felt like I was very blessed to have a rich childhood, rich tangibly as well as intangibly. I had wonderful relationships with people in that community who enriched my life in numerous ways. But I want to do something when I get down there to, I don't want to call it a payback, but I do feel like I did most of the taking and didn't do much giving. And so it'll be an opportunity when my husband and I move there to spend some time with the community doing some very limited health care.
Okay. So you brought up the subject of a husband.
Mm-hmm.
So when did that happen, and how does that intertwine with your spiritual journey?
My husband and I met in the early 1990s, shortly after I moved to Pittsburgh. And we married in 1994. Shortly thereafter, had our son. And we both have worshiped together at church. And he is not, he does read, but he is not a reader of the things that I'm drawn to read. So our dialogue at home, unfortunately, when our son was growing up, he remembers it being medicine dominated, not because my husband is also in medicine. And so my path over the past 30 years has been to worship with him, but I can't say that we really dialogue a lot at home about our faith.
Okay. So where did you get married? What was it, in a church?
Mm-hmm. Mm-hmm. So when I moved to Pittsburgh, well, let me, if you don't mind, because I think of this chronologically. I think it's my scientific mind, the order of it. I did want to mention that I did 3 years of training in Ann Arbor, Michigan. That was an extremely lonely time for me because I had geographically relocated farther away from my family and friends. It was a harsh environment in the winter with the cold weather and the wind. I remember being so cold and thinking I would never thaw out. And it was also probably the hardest academically challenging time that I had through my training period. It was really a tough stretch. And my lifeline during that time was a minister at the Presbyterian Church named Bill Hilligons, who invited me to be part of a small group he organized. It met on Wednesday mornings. I was the youngest person in the group and quite a diverse group of 11. He called us the Secret 11. And I think we were all heretics in our own way. But he called us together, and it was a time of great fellowship and spiritual enrichment for me. And I do look back on those years and the challenges of those years and my relationship with him and that group as being really a lifeline for me for survival.
Yeah.
Yeah.
So this is what, as an internist? Is that what you were doing
I
up there?
I was doing my training in rheumatology. I had finished my
Okay.
medical training. I spent 5 years at Geisinger in Central PA and then went to Ann Arbor.
Okay.
Yeah. Yeah. So the church was really instrumental in my surviving intact those 3 years. It really was a very special gift to me to be a part of that group. Yeah.
Okay.
So in Pittsburgh, I actually initially started attending Waverly when I came to the city. I ultimately transitioned to attend East Liberty Presbyterian Church, which is the large Presbyterian church not far from where we're sitting. My husband and I were married in that church. We attended that church for maybe 2 or 3 years until our son was born. We transitioned to attend Waverly because at East Liberty, for whatever reason, I didn't feel comfortable worshiping through church with Josh with us. I felt like the service was more formal and the presence of an infant was perhaps disruptive to the flow of things. I wasn't happy with that. I worked a busy schedule and my time with Josh was very precious. I wanted to have him with me as much as possible. We transitioned to Waverly and the rest is history.
So, Waverly is known to be very child-friendly and has been, no matter who the preacher is, just the culture of the church itself. Yeah. In fact, that's how we ended up there. It was because we had young children and we thought this is the place to bring young children. And it's, like you said, the rest is history. So, was there more you wanted to talk about with your spiritual journey before I ask you some questions?
I'm not sure what your questions will bring up. Cutting it off at the arrival at Waverly sort of like cutting off in midstream. It feels that way to me because the fits and starts I mentioned earlier with my journey, I feel like our arrival at Waverly and the 30 years that followed helped me tremendously in my forward movement in my relationship with God and with others on the path. I learned that my life is a pilgrimage. It's not all about trips you take and short sound bites, if you will. It's every day as part of the journey and the pilgrimage to a closer relationship to God. I have friends who have helped me along the journey. One dear friend is an Episcopal priest. She has suggested authors to read. We have discussions about our faith. Another friend from college years also is a rich source of dialogue about our faith. I think having been raised in the South in an area where slavery was part of the historical picture and involving my own family as well, that was something I shared with one of these friends. We had in common discussions about that and how to move forward beyond that to a better place. All of those are things that have played into my spiritual growth, hopefully, over the past 30 years.
So you used the term pilgrimage 2 or 3 times now. And I know that you went on at least one. And some of that you may be comfortable talking about and some not. But you know about my curiosity about the Camino. So whatever you would like to say about that, could you address that?
Sure, I'm happy to speak to, I guess there are 2 trips that come to mind that I think of in the context of pilgrimage, and it all is in how you define the term. But the first was a trip I had about 6 years ago on the occasion of my turning 60 and a close friend turning 70. There are 4 of us who were good friends and have remained good friends since my residency days in Danville, Pennsylvania. The one turning 70 decided she would like to do the Camino to celebrate her birthday, as it was a noteworthy birthday. The other 3 of us wanted to join her on this trip and participate in the celebration with her. That was something the 4 of us worked toward until shortly before the trip, when the 70-year-old decided she would prefer to do the trip by herself. That was a challenge for the 3 of us who felt excluded and caused some challenging feelings, some difficult feelings for us. But the 4 of us did travel. She traveled on her own, and the other 3 of us did our thing. And the pilgrimage, the Camino itself, had moments of being physically demanding. It was also demanding for me because I was traveling with my Episcopal priest friend and another friend. I felt, again, I'm looking back at this 6 years ago, I felt at the time inadequate or ill-equipped to extract the enrichment that I thought she was getting during that trip. So I felt a little threatened by that, which was all in my head. I recognize that, my own head and heart. But the trip did give me a tremendous gift in that the 70-year-old continues to have a distant relationship with the other 2 friends. I think we have a hard time understanding where each of the others is coming from in terms of that disruption of the trip we envisioned. But the gift I had from that trip was a capacity for forgiveness and letting go of the rejection that we felt at the time. Mm-hmm. And I have been able to sustain a relationship with that woman, and will be seeing her to spend a week with her in October, which feels like a great gift from God, because my other friends have not had the same path. Mm-hmm. I am so thankful that God gave me the capacity to do it differently, and I don't know why I received that gift, but it does feel like a great gift as a spin-off or fallout from that trip. Yeah. I often think I forgive people, but I never forget. I do truly feel that I moved beyond the challenges that I felt at that time to a different place with that friend, and I'm so grateful for that.
Yeah, I've done a lot of exploration around that concept of forgiveness. And some people in spiritual circles would say that that's the one main reason why we're here on this earth, is to learn forgiveness. And it isn't just about forgiving other people, but it's about forgiving ourselves and eventually learning the lesson that there's nothing to forgive, because we are all one and we are all part of the love of God, and end of story. So, but to get to the point of understanding that there's nothing to forgive, we have to first learn to forgive. And, that sounds like, to me, from my perspective, that was the meaningful part of that journey that you took, just to learn that concept. And it's a big one. So you mentioned that there were two. So what's the second one?
When I retired last year, my friend and I traveled with a group from the Virginia Theological Seminary to France to see Gothic cathedrals. I didn't anticipate that trip being a pilgrimage of sorts, but as I reflect back on it, it certainly was for me. Not only in terms of what I saw, but the company that I kept, because the participants in the trip were amazing individuals. Many of them were professors at this Episcopal Seminary in Alexandria, Virginia. So they brought to the table knowledge and life experiences that were enriching for me. The other aspect of the pilgrimage was, I think the trip was designed to tour these cathedrals, to give the group a chance to see the ways in which prior generations celebrated God through the construction of these beautiful edifices. The thing that surprised me was that the one stop we had that was definitely most moving for me was a stop at, I think it was called Abbey Dubec, D-U-B-E-C. And now I can't even remember the name of the ancient theologian who established that abbey. But it was very simple. It was constructed, I think the earliest construction was in 800, and subsequent additions were made to the original structure, but it was in a beautiful location, very peaceful and rural. The worship site we visited there was incredibly simple. First of all, it was open air, so nature was right there. Secondly, there were maybe 10 benches, stone benches for pews without backs. And the altar was stone, was basically a tabletop with a cross on it and maybe 2 candles.
Sounds pretty stark.
It would, traditionally speaking, I suppose, it certainly was stark in contrast to the places we had visited up to that point, but the location and the simplicity just spoke to my heart.
Yeah.
Much more so than all of the elaborate beauty we had seen prior to that point.
Now, I have interviewed a couple of other folks who made the trip to Rwanda with our church. And I've asked the same question of each of them. So I'm going to ask you this question.
Okay.
You were presented with this opportunity, and for some reason, you decided, sure, I'd like to go to Africa and deprive myself of everything that I'm used to and have this experience in a country where I don't even know why I'm going or what I'm going to do when I get there. So what was it in your mind that said, yeah, I'm going to do that?
Number of things. First of all, I love to travel. I'm always up for an adventure. And I was very drawn to the people who were participating in the trip. One challenge for me and huge lesson for me from that trip was that I'm not necessarily organized. If you were to walk into my house, you would laugh at the term organization, but I do like to plan and know what my agenda is going to be, what my goals are, what I'm setting out to accomplish. A huge lesson I learned in my participation on that trip was that when God's in charge, you don't always know what's ahead, and you can't always plan and predict what's going to happen. You have to just sort of jump off the cliff and trust that the parachute's going to open. So I remember being incredibly frustrated when I would ask you, what are we going to do? What are we going to do? I wanted to know what the action plan was going to be for this trip, and I never got a straight answer. It was a huge frustration for me and made me wonder if I really was supposed to be going on this trip. But once we arrived, I learned to appreciate the fact that our presence was the important piece, the demonstration of our love for the children who were there and support of them, and the tangible accomplishments were not necessarily the do-all, end-all of God's mission for us.
Yeah. So all in all, you were glad you went?
Oh, totally. And it helped to prepare me for our transition to North Carolina, I think, because I have felt resistance within myself and this whole idea of moving to North Carolina. I'm thinking, what in the world are we going to be doing in North Carolina? It's a rural area. I thrive on city action and opportunities to do and see things here that will definitely not be available where I'm moving. The nearest grocery store is 20 miles away.
Oh my gosh.
So I am trying to let go of my desire to be in control and to predict what the future is going to hold for me.
Yeah.
And let things evolve as they are to be. Opportunities have come up that I think will provide ways for me to give back to the community. I mentioned my part-time work in it will be a federally qualified health center, which provides health care for migrants and people with limited health insurance. And that's about 20 miles from where we will be living. And I have become involved in the state park that is about 5 miles from our house, which is a beautiful spot to commune with nature and to pray and be close to God. And who knows what's ahead? I'm trying to let go the urge for control and prediction of the future, which none of us can do, and just trust that God's going to drive the ship.
Yeah. Okay. Well, I'm, as we plan for next year in terms of another trip to Rwanda as a possibility, I can use your words to help promote the next trip.
Yeah.
So that's great. So we've got a little bit of time left, but not a whole lot. So I wanted to talk about something that happened 10 years ago, and I mentioned that you were on this committee, and it was the way that I read it is Mary Chester Wasko, MD, MSc. What is an MSc, by the way?
When I was in Michigan, I completed a master's degree to prepare me for some clinical research that I
Okay, so that SC is clinical.
Medical, what is it? Master's in biostatistics and clinical research design. So it's a master's in science.
Okay. And I did notice that you had a few published papers. I didn't read them, but I saw the titles. So they're online, those of you listening, if you want to know more. So the whole idea of this discussion at the state capitol in Harrisburg was a round table that was hosted by the chair of the Pennsylvania Legislative Black Caucus. And it had to do with women's health in the workplace. So you addressed some issues there. And again, that was 10 years ago. In terms of rheumatoid arthritis being a debilitating disease, and that it attacks women a lot more than men. So in the workplace, it was costing the nation billions of dollars in lost productivity because they had to reduce their hours, they had to retire early, possibly lose their jobs because of this. So that was 10 years ago. Do you see any change in the workplace or any changes that came from this particular roundtable discussion?
I can't say that I know enough about the fallout of that particular roundtable to comment on it, but I definitely have seen an evolution over my 30-plus years as a rheumatologist in the impact of rheumatoid arthritis and other types of arthritis on one's ability to work and support themselves. Yeah. I'm old enough to remember the era of gold shots and 12 to 14 aspirin a day to treat rheumatoid arthritis. We have moved way beyond that with some of the new therapies that you see advertised on TV. They have revolutionized the care of rheumatoid arthritis as well as other types of autoimmune disease. The fallout from those advances is that patients are better able to maintain their employment because their arthritis is under better control, so they function more normally. Yeah. The downside is that these meds are quite costly. The access to those medications can sometimes be limited by what health insurance will cover, what a patient is willing to accept as a therapy, because as with anything, they come with risks and benefits. But definitely the fallout of these new therapies is that patients are better able to remain in the workforce and care for themselves, their families, maintain their employment. So that has been a huge advance.
Yeah. Okay. After reading that article, I was just curious to.
No, it
you
was
always
interesting.
wonder, do these political approaches to social problems and medical issues ever have a result? Or
Well, I will say it was a one-day event that was sparsely attended, and in retrospect, I felt like it was something they could check off a list that it had taken place. I can't say that I am necessarily optimistic about what the fallout of what that particular event might have been, but I was certainly happy to participate and offer my perspective. I don't know that it was more than just a little blip on the radar.
Yeah.
Unfortunately.
Okay. All right. So we have reached the end of our time, almost. And as you know, at the end of every podcast, I ask the guest to leave us with some words of wisdom, or at least some words. So here we are at that point, and I know that I've prepared you for this, I hope. So the mic is yours.
I have had the benefit of being the recipient of many coincidences or serendipitous events that have helped to advance my faith journey. A non-spiritual or non-religious person might think of those events as coincidences or serendipity. I have learned to accept them as gifts from God. Moments or people or books or events that came my way to help me along my journey, and I just pray that I remain astute enough to recognize them when they come.
Okay. Because many people would say there's no such thing as a coincidence.
That's right. I believe it.
So one last question. Because you've talked about books that have been recommended to you and books that have helped you along the way. Could you mention a couple of those book titles that you feel were important?
Sure.
In your spiritual formation?
When I was on the plane returning from France last year, I read a book by Richard Rohr entitled Falling Upward. A phenomenal book, very timely read for me, that addresses how one might approach the latter half of life, very loosely defined, in terms of a spiritual journey and how to move forward during the latter years of one's life to make that a meaningful time. I very much felt that was one of those serendipitous things that landed in my lap at the right time.
Yeah.
At a right time. Barbara Brown Taylor is another favorite of mine. And while I have not read much of his writing, I also am a fan of Malcolm Guite.
I'm going to ask you to spell his last name.
Yes, Guite. He writes a lot about pilgrimage. One's life as a pilgrimage.
Okay. Okay, thank you for that. And audience, as you know, I will have references to these things and some of the things we've talked about on the website. So if you wish to explore further, you may. So until next time, this has been your spiritual journey.